Aloha and hello everyone, and thank you so much for joining us today. My name is Christina Higa and I'm the co-director of the Pacific Basin Telehealth Resource Center. Welcome to the National Telehealth Resource Center's webinar series. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. These webinars are presented on the third Thursday of each month. Next slide, please. Located throughout our country, there are 12 regional telehealth resource centers and 2 national centers. Our mission is to advance the effective use of the telehealth and support access to services in rural and underserved communities. Next slide. For today's presentation, with just a few tips before we get started. First, your audio has been muted, and we're going to use the Q&A function of the Zoom platform at the very end of the presentation. Today's webinar and the resources that Dr. Roth will present to you will be recorded and posted on our National TRC's YouTube channel. Next slide. Today's webinar is hosted by the Pacific Basin Telehealth Resource Center, and it's my privilege to introduce Dr. David Roth. He is a triple board certified physician who practices a combination of developmental pediatrics, child adolescent psychiatry, adult psychiatry, and neurology. He and his wife launched one of the nation's first full-scale telepsychiatry program to deliver psychiatric services to children who live here in Hawaii on the islands of Maui, Molokai, and Lanai in 2010. And then he expanded it statewide in 2014. The services were delivered to students in their homes and schools and in collaboration with families and school-based clinicians. Dr. Roth also developed comprehensive telehealth training materials and has presented his work in numerous national venues, including the annual conference on advancing school mental health and several times at the American Academy of Child and Adolescent Psychiatry and at numerous national telemedicine conferences. So we welcome you, Dr. Roth.
Well, thank you. I appreciate that lovely introduction. Good morning for many of you. Good afternoon for the rest. I wanted to start off saying I know conflicts of interest. Right now, this is all just self-funded as an endeavor we do in the clinic, trying to teach people how to do it well. As she said, I've been doing telemedicine for many years, started out academically in 2000, and then really expanded in 2009 when we felt the technology was ready for a wider scale deployment. So after over 30,000 sessions, we've learned a few things, and we want to share these strategies with you because we feel that when you're more confident and more competent, you're a better telepsychiatry or telemedicine provider. Because in our opinion, telemedicine is more than just a provider and a camera. So some of the core concepts that we want you to take away with today. Telemedicine is really a new venue for delivering medical care. And so that's why it's so important to create authentic engagement and rapport between the patient and the provider. It's actually more dependent on the provider's skills than normal because there's nothing in the environment to cue that relationship. You don't have lovely buildings, framed diplomas, or any staff to set the stage. And so you really need to focus on that engagement and rapport, and our understanding of that has some core components we're going to review today, such as thoughtful room staging, intentional participant arrangement, having a technical understanding of the equipment and software, enhancing your nonverbal communication, and strategic time management. So let's begin with a little exercise. Everyone, take out your phone, introduce yourself to someone next to you, and take their picture. If you're alone, a selfie will do. I'll give you a couple seconds to do this. And wrapping up. Okay. So, are you proud of the picture? Do you think you can do better? And do you think the other person would let you post it on Instagram? So we've done that exercise to bring to light some of the assumptions we have about how easy it must be just to get on camera. But when you take that snapshot and get some feedback, we usually can do better. And that's what we want to focus on today, how to intentionally do better so you create and sustain a very engaging experience. So let's start with setting the stage. The key things here are privacy, a good internet connection, minimal distraction and a professional setting, participant comfort, see and be seen, hear and be heard. Let's talk about privacy. Anybody see what's wrong in this picture? When it comes to power and network, we want to make sure that you're using good equipment and it's healthy and maintained well, but some of the core things for the modern age are Wi-Fi. And because a lot of our patients are using their own portable devices, it's become really critical to be close to the Wi-Fi router so that there's a strong signal. Anyone who has a more permanently installed device needs to be plugged into their Ethernet cable. Now, the furnishings reflect the professionalism too, whether it's a really nice conference room, a not so nice conference room, or a typical room. And that's where it's critical to use proper staging so that you see what you need to see and show what you need to show. Because the wall colors can affect the camera too, you want to make sure that that scheme is set up to look good and not be distracting. And you want to minimize background noises. Here's something. I think you figured out which one wasn't the real one. So don't just take the advice from me. One of our partners in the project is a news anchor, and she has a little bit of advice for you as well.
Well, in a video conference situation, inevitably the dog is going to bark or the little baby might start crying. And the most important thing to do is just to laugh it off and say, it's okay. You know, try to fix whatever might be happening or get over the disruption and try your best to get back into the conversation.
So let's move on to framing. So the general rule of framing is the 1/3 rule, and this is what Christine and I have accomplished today, where our eyes are in that top third of the screen, and that gives a more natural look and allows the person to be a visual priority. And this is what newscasters try to accomplish as well. It creates that more intimate appearance and engagement. And in order to accomplish this, you want to make sure that your camera is mounted at eye level, or the participants keep theirs at eye level. And that allows you to then arrange the people with that camera in mind so that you get either a cluster of one or more people. The general rule of thumb with this is for every additional person, you need to move them 2 feet back from the camera in order for everyone to fit comfortably in the frame. Although, to be honest, sometimes you need to smush together. Now, if you've got a cooperative child, being on the lap can be very helpful. But sometimes they're a little bit more impulsive, so the screen will need to be set so that, the camera will need to be set a little farther back to give them room to roam or to play. And this is another example.
You see him in the back?
I can, that's probably why I'm doing it, is so we can have a great example of how you guys can work with me while he's still doing his own thing.
Okay, good.
So Rosie, you can come back in the frame.
There we go, we got both of us, you got Keanu, perfect.
Yeah, awesome. And sometimes you have to wonder how much space is enough. Come on. Howdy, folks. And eventually he does come back. But sometimes a wider frame is important. And this is also tells you a lot about the relationship of the people you may be working with, whether they're oppositional or depressed. So let's move on to lighting, because without good lighting, it's hard to see what's going on, and that distracts you and the viewer and makes it a less authentic setting. So with insufficient lighting, this is what you see. And then when you turn on lights that may seem normal to you in the room, you can see from the other person's perspective, it's still dark. And so that's where you need additional staging lights to adequately light the session. And you can go too far, but often you just need to have at least one more light in front of the subject. So there's a lot of different options for sounds and microphones. What I would suggest is whenever possible, use a high quality microphone. And for privacy, headphones can be very helpful. In conference room settings, you'll often have mics that are tethered by a cord. And again, it's important to deploy those and put them in close proximity to the speakers. And then lastly, if you have the option of using a duplex phone instead of a standard speakerphone, I'd highly encourage it, because the old phones don't allow for someone to interrupt a monologuing speaker. So let's go over a few common problems that we think you'd be able to avoid or at least anticipate.
So what do you do when something goes wrong with a video conference? Well, first thing, you have to realize something will go wrong. Just get over it. 20 years of television news, something went wrong in the show every single day. So I'm used to problem solving, dealing with technical issues, and the most important thing to do when a technical issue happens is to let the person know on the other end that it's going to be okay.
So one of the most common things is to have a backup internet service provider. We had to use this the other day. One of the fun things about Hawaii is sometimes the internet goes out when it rains. Typically, if a patient can't see you, there may be a software setting you have to adjust. That's where using the chat function or calling them can be very helpful to show them what you need to do in a screen share setting, or just walking them through the setup. But that's where you need to be able to know the setting process for your software very well, so you can do it blind. And similarly, audio is often just a need to switch the device that's set in the software, and then very commonly we'll end up having to call on a separate audio line if you're unable to communicate adequately with the software. One of the problems that commonly occurs is people will have a Bluetooth or other speaker, and the computer or device can't cancel out the sound that it's producing with those extra speakers, creating an echo. And then most annoyingly, you can get that feedback loop. And for those of you who aren't understanding what I'm saying, this is the feedback loop. And then the mute button is the best way to get rid of that. Other common sounds that typically distract a conference. So my pet peeve is actually the shuffling papers. For some reason, microphones love the sound of shuffling papers. So please use the mute button if you need to do something like that. Now, keyboard clicks is inevitable because most of us have to use an electronic health record to document the encounter, and it makes sense to document during the session. But some keyboards can be conspicuously loud and very distracting for the participants. So some of the strategies can include using a quieter keyboard. There are some brands that are better. Other things are an underlayment, like you see in the right-hand corner, the black layment, and that absorbs some of the sound. And then thirdly is separating the keyboard from the device, either in a lap tray or just moving it towards you. And so sometimes that prevents the tabletop or desk from functioning as a soundboard, amplifying the noise. Managing the background also includes managing shiny surfaces. So whether it's a window or a whiteboard, the glare can be distracting. And again, anything that distracts takes away from the moment and messes up the engagement, and that lowers the quality of care that the provider is able to deliver. And if you start lowering the quality of care, providers don't want to continue doing it, and patients don't want to continue receiving it. Now, falling out of frame is a very common problem we see with people who are just starting out because they're not mindful of how they are on camera and in the frame. And so if you don't have a feedback video of yourself, which many people are uncomfortable seeing, if you don't have that, then you can't see what you're doing. And that raises the risk of falling out of frame. Again, that breaks that state of engagement and creates a distance in the encounter that can be reflected in the clinical care received. Now, a lot of our patients want to be holding the phone these days. This is one of the patients just doing this for fun with me, but this is very similar to how a lot of the teenagers will do if we don't insist that they prop the device up properly and don't try to hold it the whole time. So let's move on to some of the ways to appear more professional and compassionate in the telemedicine venue.
You have to rise above the fact that you're really talking to just a flat computer screen. And part of it's acting. Part of it is you're just kind of faking it. But don't think of it as faking it. And don't think of it as being unrealistic, because you're really trying to portray and trying to tell them very important information. And so when you do it in a way that's perhaps a little more animated than what you're used to, it's actually not when they're receiving it on the other end.
So why do we have to behave differently on camera? Well, it's because the camera restricts things. It restricts our ability to see the whole person. You're not seeing my hands unless I bring them up into the frame here today. It makes it hard to be heard and well understood. You can't touch the person. You can't smell the person. You can't show and see all the gestures. It sometimes is difficult to maintain eye contact. And that all filters down to being an impediment to demonstrating your usual bedside manners. And that makes it difficult to seem genuine and compassionate. So what's creating these deficits? The camera's limited frame, for one, and that limits physically what's perceptible to the other person. But it also removes some of the nonverbal information that is used to engage and maintain the rapport. And by eliminating that nonverbal communication, you're not communicating a lot of the feeling, a lot of the priority, a lot of the gestures really convey intent. And overall, some studies show that only 7% of our real information conveyed in a conversation is in the words themselves. So much of it is done in the gestures, in the nonverbals like eye contact and tone of voice, that it can be even misleading if you're not getting all that nonverbal information. So let's break this nonverbal down a little bit for those of you who haven't already studied it. Nonverbal communication is broken up into things like physical appearance, your vocalics or your voice control, kinesics, which is body movements, gestures, and posture, proxemics, which is distance, and haptics, which is touch. So let's talk a bit first about provider appearance. This is why professional appearance matters more in telemedicine. It's not that you need to be all made up like a stage makeup, but you certainly need to make sure that you're groomed well, because this is the majority of what you see. If what you're seeing of me now is all you see of me as a physician, there's nothing to tell you I'm a physician in this frame other than my words. So I need to be professionally dressed. And for those of you on the mainland, this is a professional dress shirt for here in Honolulu. So vocalics is very important. And anyone who's studied acting or done public speaking knows the importance of how you speak. And this is the rate, the rhythm, volume, the prosody, which is that sing-song in your voice, how you emphasize things, and how you pause. Body position is also important, because if you're facing away, it's even more obvious on camera. A slight turn of my body can generate a very clear sense of distance or disengagement. Similarly, if I'm sitting and I'm crossing my arms, that's all you're seeing about me. And it sheds a very negative connotation on being closed off in that moment. So there are some ways to improve our kinesics, and simple things like a thumbs up gesture, raising eyebrows, or nodding can have a big impact on conveying your information and maintaining the rapport, even when you're not speaking. And similarly, if you're in a group setting, you can be doing these things to support another person speaking. Now, facial expressions are obviously super important in all of the work we do as clinicians, but on camera, it's the majority of what people see. And so what we've noticed specifically in telemedicine when people are starting out is there's a tendency to get nervous, a little anxious, a little self-conscious. And so we end up with the vacant stare, which is often from anxiety, and the technique face. And the technique face comes from when you're focusing so much on what you're doing that your face doesn't reflect the joy you have in doing it. And rather that it gets more of a stern and distracted look, which can be quite off-putting. So in terms of facial expressions, if you can just remember two things from today in this area, it's nod and smile. because if you can remind yourself every few minutes to nod and smile, you're encouraging the other person, the other people to continue sharing, to continue the experience. And that goes a long way to make up for the eye contact you have to break when you look at an electronic health record or look away to do something else and break that apparent eye contact. So this goes a long way to keeping things going. Now, there are other ways to improve our proxemics or our perception of the distance between people. And here you see pictures of a professional cameraman demonstrating the power of that lean forward into the camera or a slight leaning back. This conveys a lot of what we might do in a regular clinic setting by taking a step forward or a step or two back. But in the camera, a few inches creates that same sense of coming towards with interest and intimacy, or providing a little bit more space and breathing room for someone. Now, obviously you can't touch a person. That's pretty simple here. We haven't been able to fit things through the camera yet. But you can mimic some of the gestures that involve touch. And one of the fun things with adolescents is the fist bump you're seeing here. And we also do things like waving, giving high fives, and especially with the kids, they enjoy that part. But because greeting with some sort of a touch, like a handshake, is so customary, it feels like the encounter is diminished if there isn't that kind of physicality. And so by intentionally adding a gesture to replace a haptic, you're compensating a bit for that lost nonverbal communication. So what we're trying to help you understand is that you can make up for this deficit by intentionally using your nonverbal as well. And by doing this, you will replicate the good bedside manners that you would typically have without a camera. And this helps you form that strong engagement and sustain the good rapport that is so critical to providing good healthcare. And lastly, it helps compensate for the camera's deficits to enable you to appear attentive and to show the genuine interest you have in the other person. And that together creates that authentic experience and prevents both patients from being disinterested in telemedicine and providers from being dissatisfied with telemedicine.
So you're a physician and you are the best that you can be, and you know what you're talking about. You've studied it for years. So don't forget that, because you have an important message to convey. And when you walk into a situation, of course you're going to be nervous. Of course you're going to worry about the camera. You're going to worry about the way you sound, the way you look. But you know what? Just take a deep breath and tell yourself over and over again, it's going to be okay.
We've trained up a lot of people over the years, and the biggest thing we've seen is the anxiety that comes from feeling like you're not prepared to do this well on camera. And so what we want to make sure that you come away with is an understanding that, yes, there are many ways it can go badly, but with a better understanding of these core topics, as well as sufficient practice and many times some mentorship, you can actually do well. So we want you to feel comfortable. We want you to feel competent to do telemedicine well. And just to give you a little sense of how you've already improved, here are a couple slides where you can test your knowledge. So each of these slides will demonstrate either a good or a bad technique. All right. So for those of you who have somebody with you, you can discuss it. Obviously, we can't get the feedback here I would enjoy, but this one, good framing, good gesture, good smile, and good eye contact. And what do you think is wrong about this one? So eye contact is off. The light is too strong, causing the camera to overexpose the image. What do we think is wrong with this one? So, typical privacy issue. Here, you're already recognizing the importance of overcoming any anxiety you may have about monitoring yourself and making sure that you stay in the frame. So this one, good framing, Eyes are in that top third. Good eye contact, good natural smile, open body posture. So one of the things that people assume here in Hawaii is that we have offices that look out over the ocean with lovely sunsets, and that may be true for some folks, but this is what can happen if that lovely sunset is shining onto you during the session. It can actually create a color imbalance from one side. So you must actually control the light very well, and that may mean closing blinds that otherwise would have made for a nice view for you, but you need to improve the view of you for the participants. Microphone really picks up well, including the shuffling feet, shuffling paper. So here we have an example of what we call the technique face, when someone is either struggling with their electronic health record software or having trouble figuring out what they want to do next to help the patient. It's important to remember that your expression is still viewed the whole time, and to try to maintain a positive look on things even when you're struggling. So remember, you can make up for the lost haptics, the lost touch, by replacing it with more intentional gestures. And this is also fun for the provider. Now, if anyone's ever tried to write a prescription during a telehealth session, this is what it looks like if you bend down to write on a prescription pad. So keep this in mind, that if you come too close to the camera, it really distorts the image. And again, creates a sense of that this is not real, this is not normal, this is not the usual way that, the medicine is provided. So this is a reminder about keeping the lighting adequate. You want to have more than is necessary for the provider. This is a very common situation that you'll face. You'll have a lot of people who want to use a cell phone these days, and you really need to, to cultivate that in them and teach them how to properly place it and use it. One other aspect about using a cell phone is that when you rotate the phone, you actually rotate the picture. So when you rotate it sideways into landscape mode, you get a wider picture. So if you have more than one person using that device, you probably want them to switch to landscape mode so they can both be seen easier. However, if it's a single person, their eyes won't be looking at their camera when they look at it in landscape mode, and that can seem very off-putting, like you're looking over someone's shoulder. And lastly, this is about making sure you're using culturally congruent gestures as well as gestures to convey your feelings, to engage and maintain the rapport. And this is our local hand sign, the shaka. Additionally, he has good professional dress, smiling, good eye contact, and the eyes are in the upper third. So thanks for participating today. I hope that you've been inspired to learn how to do this a bit better and have a little bit better understanding of how you can already start doing telemedicine well. So thank you very much. I'll turn things back over to Christina.
Thank you so much, Dr. Roth, for such an informative and entertaining presentation. I wanted to let you know that we had such a great turnout today with 170 participants. Yeah, it's fantastic. We will address questions in just a moment after two announcements. First, I would like to let everyone know that the next National TRC webinar is scheduled for Thursday, May 16th, and the title, Distance Counseling Best Practices in Higher Education. Registration and further information will be sent out soon. And the next slide. We are we value your opinion, and we would like to ask you to just take a few moments, just a few minutes to complete this online survey. And there's a SurveyMonkey link there that will take you to the survey. And so now we can go ahead and address some questions for Dr. Roth. There was a question that was written in the Q&A. Others, if you have questions, just go ahead and look for the Q&A panel in the Zoom application and write the questions there. So Dr. Roth, the first question is from Marie Lee. She asks, is this part of a formal training process for your organization? Who is responsible for this training? And how well is this received by the providers?
Excellent questions. This is a distillation of what we initially did for our own providers and then developed for the Academy of Child and Adolescent Psychiatry. There are various snippets available on the website for the Academy, as well as the American Psychiatric Association has a toolkit. But we've been doing this since 2014, even before there was a greater awareness of the role of this kind of nonverbal communication and staging. And so it's evolved over time. So I'm one of the principal people teaching it. My wife is one of the co-presenters. Some of the people you saw in the presentation, the cameraman and the network anchor, have also been co-presenters at some of the national conferences, like the American Telemedicine Association. So we're in the process of developing the full standardized curriculum that can be purchased by organizations. But at the moment, we're simply providing on-site consultations, individual consultation and training to people who want it.
Okay, great, thank you. There are several other questions coming up. One is to please show the YouTube address site again. So just a reminder for everyone that a recording of this video will be placed on, if you Google the National Telehealth Resource Centers and look for past webinars, you'll be able to find the links there. Let's see, from Kathleen Myers, do you instruct your participants on good technique also?
Absolutely. One of the things that the TRC is nice enough to distribute is a booklet that we give out to our patients, guiding them on how to set up this at home. And it runs through the same principles that we talked about here, with more of an emphasis on staging and camera arrangement, so that they understand if it's an individual or a family, how they want to set up the experience so it works well for them as well as for us. And so it's important to train them. We usually have them meet with our office staff ahead of time to make sure that the equipment is working correctly, to make sure they're set up in an appropriate room with enough privacy, because it is important for them to feel comfortable, because although many people are used to FaceTiming, they're not used to doing this with a clinician. And there's a little bit of a learning curve to do it in a way that we get all the information we think is important, not just what they default to by propping up a phone.
Thank you. There's a comment and then a question. Darlene Coop says, thank you. I really think that all new telemed specialists should watch this too. I agree. And another comment from Kathleen Myers, is the reimbursement appropriate for your time?
In Hawaii, we're fortunate that the laws were set up that parity exists with telemedicine. And so the reimbursement is just as fair as PPO and HMO payments are normally. I'll leave it to you to decide if that's a fair payment in itself. But we're fortunate in that respect here. There are other places that don't pay as much for telemedicine. And to be honest, I'm not sure how someone would devalue it, because the quality of the interaction can be just as good if you do this right. And the outcomes have been proven to be just as good. Matter of fact, Dr. Myers is one of the clinicians who did one of the pioneering studies of ADHD treatment over telemedicine and showed that the outcomes were equivocal. There are many studies that even show that engagement with teenagers is superior in telemedicine. And so you would think outcomes might even exceed standard of care. And lastly, what you're seeing with this done well is that providers are able to enjoy it and do it well. And so it becomes a reciprocal, good experience where everyone's excited and optimistic and really engaged. And then that just promotes good patient care.
Thank you. And finally, there is a comment. I'm a clinical psychologist, and my clients love, in all caps, receiving and participating in therapy via telehealth, as do I. I think that's a great comment to have at the end here, but there are questions still coming in, Dr. Roth. Next
Sure.
one, do you get paid from all insurance payers or only specific payers?
Well, That's a good question. We actually recently ran into trouble with one of our local payers who decided that they were only reimbursing telehealth when it was a clinician to clinician consult. And that doesn't actually meet with the law here in Hawaii. So we're going to be having a discussion with the medical director at that organization. So you're going to find that it's unequal, even within communities where it's becoming the standard of care. Some of my colleagues in the East Coast are struggling with getting reimbursed from private providers. And then certainly Medicare hasn't offered up reimbursement for most situations yet. They have some initial pilots, and Medicaid is a state-by-state issue. And then of course, not at this point, medical malpractice liability insurers are covering it, but initially that was an issue too. And then of course, you run into issues of doing this over state lines and getting reimbursed for that. And that defaults back to the concept of a medical licensure. And if you're licensed in both states or you're not, that determines whether it's something you can go forward with. So although the technology is certainly well established, although the clinical practice guidelines are well established and they're available on most of the academy websites like the Academy of Child and Adolescent Psychiatry, and the outcomes research is well established, there still is a resistance to paying for it. And the challenge that I see is that some of the big for-profit players in medicine are going ahead and moving forward with this. So you're getting, the Walgreens clinics and the CVS clinics that are starting to offer telemedicine as part of their service array. And they're going ahead and doing this before the clinicians are adopting it nationwide and establishing a standard of care that we feel is good medicine. So my biggest concern is that the delay in people taking on telemedicine as a skill set and deploying it effectively in their practice is that other people might set the rules for us instead of us saying what's important for training, what's important for quality assurance, and how do you do telemedicine well.
Thank you very much, Dr. Roth. I would like to just leave a few moments to see if there are any other questions. I don't see any online, but we'll check. As we're waiting, I wanted to mention that the recent law, State of Hawaii, is Act 226, if you're interested. It passed 2 years ago. And as Dr. Roth mentioned, we have it in law, but it takes time for it to be implemented into procedure, down to the codes and letting providers know that payment is available. But even our, patients and families, we're still working on outreach to let people know that, we're going through transition. And so even though you have it on the books and law, it takes time.
It does. It takes advocacy, and that's where places like the Telehealth Resource Centers are very helpful, because each community, each state, each region is going to face different obstacles, political will that's supportive, or commercial pressures that are supportive or antagonistic. And the resource centers will help you understand what you need in your community to make it work.
Yes, thank you for that, Dr. Roth. There is another question. How do you reduce antibiotic overprescription via telemedicine?
It's a great question. I actually don't have an answer for that. I think we're facing a huge problem with that in the pediatric and adult community anyways. And certainly the anxiety that comes from missing an infection that you could have cured is enough to drive some of that overprescribing. I think in the internal medicine and pediatric use of telemedicine, there are remote devices. So otoscopes, ophthalmoscopes, stethoscopes, which would allow you to have the same visualization and then prescribe as you normally would in a clinic. I think that the concern would be if you're in a kiosk situation where those devices are not part of the technology, then it would probably encourage overprescribing because you can't do the same quality job you do in a clinic. And so that's part of the push to make telemedicine done properly, because you want to replicate good clinical care or exceed the standard of care. You definitely don't want the bar to drop.
Okay, great. Thank you very much. I don't see any other questions now, so I'd like to On behalf of all 170 participants that joined today, Dr. Roth, I want to say mahalo. Thank you so much for your time and sharing your information with us. I would like to invite the participants to check our National Consortium of Telehealth Resource Centers to look for your own regional center. There you'll find this webinar and our past webinars also on as resources. As past webinars you can view at your own leisure, and also resources of the guidebooks that Dr. Roth had mentioned that so generously will be sharing with all of us, that will be made available to you as well. So thank you again for your participation. Thank you again, Dr. Roth. Again, this is Christina Higa from the Pacific Basin Telehealth Resource Center, and we would like to now end the session for today. Thank you.
All right. Aloha, folks.